really trying to say here is that eye care professionals have options. And this is something that, again, that Dr. Edlow touched on. I think it's important when we talk about supply and demand within the eye care profession, it's also important to touch on supply and demand in greater healthcare as well, because I think that there certainly has been a trickle-down effect in greater healthcare into what we're experiencing in eye care. Again, Dr. Edlow mentioned other types of professionals now, like PAs, for example, beginning to provide service in retina specialist offices. So what's happened in healthcare in a broader sense certainly has had an impact. I started Local Eyesight back in 2007, right at the beginning of certainly the worst recession of my time. No one ever said I had good timing. So what happened between 2007 and 2010 is unemployment went up to about 10%, and the economy shed over 9 million jobs during that time period. Okay, between 2007 and 2010. And I'm talking about all industries outside of healthcare. The economy shed over 9 million jobs during that time period. So during that 3 years that we lost 9 million jobs in the greater economy, healthcare added 600,000 jobs. I just want to stop for a second and let that sink in a little bit, right? The economy outside of healthcare loses 9 million jobs. Simultaneously, healthcare adds 600,000 jobs. So you can see what's going on in this space that we're in, and what's happened since then certainly is that unemployment in the entire economy has now dropped to below 5%, and we've been watching unemployment drop over the last few years. But the knock on the economic growth is that although unemployment was dropping, wages were not rising. Well, even that's starting to change. When you look at wages across the entire economy in 2016, they were up about 3.1%. Okay? That's pretty significant. It doesn't sound like a huge number, but if you consider the time period, the 10 years between 2007 and 2017, the average wage increase during that time was 0.3%. So wages are up at about 10 times the rate that they have been since the recession started in 2007. Okay, so we're seeing a lot more pressure on employers to recruit just because of simple supply and demand dynamics. U.S. News and World Report comes out every year with their best jobs in the economy. I'm sure you guys have all seen that. And that report is typically dominated by healthcare, but this year I looked at it, and 8 of the top 10 jobs in that report are healthcare-related positions. The report actually documents about 100 different types of jobs, and roughly 50 of the 100 are healthcare-related. So there's no question that healthcare professionals, eye care professionals have options, and this is putting some pressure on us as an industry to find good people.